Hi, I'm Ira from Lavender Medicare. Thank you for joining us today. Today, we are inviting Dr. Chou Ning, a senior consultant in neurosurgery, to share more with us about brain tumor, how we can prevent and how to treat it. What is the symptoms when people have brain tumor?
Sometimes they present with seizures or headaches or visual problems. So whenever patients present to us with either numbness or weakness somewhere, we would tend to localize these symptoms to certain areas of the brain. The most common way to settle this is that we arrange for a scan of the brain. The scan of the brain will then show us where the location of the tumor, the size of the tumor, and whether there are any important nerves or vital structures around the tumor.
Is it a prolonged headache that we need to be aware of?
Headaches are generally caused when the tumor starts to grow to a significant size. So when the tumors grow to a significant size, it is causing pressure in the brain itself. And when that happens, the patients tend to complain of early morning headaches.
People with brain tumor, do they also lose weight?
Brain tumors in general tend to stay within the brain. They do not metastasize out of the central nervous system. That means they stay within the brain, they stay within the spine. So in general, it is not really associated with weight loss.
What kind of treatment do you usually give for patients who present with brain tumors?
When we look at the scans in the brain, there are certain lesions, the shape and size, will indicate to you these are in general benign tumors. On the other hand, sometimes the location, sometimes the shape, the structure of the tumor indicate to you that this is a malignant tumor. So actually all our mortality depends on what sort of tumor it is. If it is a benign tumor, large, we just straightforward excision is fine. On the other hand, if it is a malignant tumor, then basically in the case like for example like a malignant glioma. So those kind of cases, we need to debulk as much as possible, and once we have confirmed histology, we need to follow on with chemotherapy and radiotherapy. But on the other hand, small benign tumors, we can easily treat with stereotactic radiotherapy, gamma knife. I do it all the time. So it all depends on the size, the location, the type of tumor.
So do you actually need to do a biopsy before you can decide the treatment?
Yeah, for malignant tumors that we would tend to, but in certain areas of the brain, we may not need to have a histological diagnosis. It is accepted practice just to move on with just radiotherapy, stereotactic radiotherapy.
So when you need to take biopsy, is there any laparoscopic way to do it?
Oh yes. Of course, one way is to open up the brain and take out the tumor. But sometimes the brain tumor is deep in the skull. So what we do is that we use a needle biopsy. We scan the patient's head and then we just drill a small hole with navigation. We would direct us exactly into the spot, take a little small spot and we come out.
Then it will not cause any infections?
Because the skin is stitched over it, so there isn't a problem. In general, the infection from post-neurosurgery is very rare.
For radiotherapy, is there any side effect?
Of course, with repeated radiotherapy, of course, the risk goes up. But in general, radiotherapy is as far compared to surgery itself, because surgery you have the risk of general anesthesia, you have the risk of the surgery, you have risk of bleeding, but in radiotherapy you have no risk of general anesthesia, so the risk of radiotherapy is far lower. Sometimes when the tumor is big, then you have no option but to do surgery. But sometimes patients come in with, for example, cancer of some parts of the body that spread to the brain. So when it spread to the brain, sometimes the lesions are small and are scattered throughout the brain. Maybe 2 or 3 deep lesions on the right, then 1 or 2 deep lesions on the left. So what we do is that we use stereotactic radiotherapy and just to irradiate and kill the tumor cells. Very easily done.
But can we prevent brain tumor?
A lot of times when patient comes to me, they ask me, "Doctor, why am I having this tumor?" I think most of the time, I don't have the answer for them. I know that certain tumors are associated with certain genetic mutation, genetic variation, but why they have it, no one really knows the answer.
If you find anything aggressive, how long does the patient have?
Just come, don't wait, because even if it's prolonged symptoms for many years, some tumors grow very slow. They are so slow growing, and they slowly get bigger and bigger and slowly push the brain aside. You know, I've met a pilot, right? For years he had been having severe headaches, but he was so fit, he passed all his medical examination. But you know, eventually when they decide to scan his head, he had a 9 cm meningioma inside his head. 9 cm is huge, you know. So yeah, he did well, and he, after the excision of tumor, he was totally intact.